So we're going to go ahead and get going. So once again, I'm Dr. Corinne Russo. I'm a pelvic floor physical therapist. I'm also just a physical therapist, but I specialize in the pelvic floor. For our agenda for today, so we're just going to go over a general introduction, and then we're going to go into a little bit of detail about the pelvic floor and core anatomy. Then we're going to go into the types of the urinary incontinence, and then what to expect at pelvic floor physical therapy, and then some final tips and takeaways, and then we'll leave question and answer for the end. So I just want to start off like this, whether you are mom, even there might not even be some moms on this. There might just be some people who have experienced urinary incontinence without being a mom, but these are super common things. So let me ask you, these questions might resonate with you and or you've had experience once in your life, or maybe multiple times in your lifetime. So some common things happen some common questions that I ask is, do you cross your legs when you sneeze, laugh, or cough? Do you avoid jumping jacks in workout classes? Do you suck in your stomach all day long? Do you limit your water intake to avoid leakage during running errands and or working out? Do you always make sure to have a bathroom nearby when traveling? So these are common questions I ask because these are common things, but that doesn't mean they're necessarily all normal. Just because they're common doesn't mean it's normal once again. So this is something that has happened, and this is what I see typically in individuals who experience urinary leakage or any issues with bladder. So we're going to dive a little bit deeper as to why you do not have to live the rest of your life to have urinary leakage. So we're going to go into the functions of the pelvic floor. You can see here on the left, there's a little bit of it's actually like live. So you can see the front is the pubic bone and the back is the tailbone. You see that pink strip on the bottom is the pelvic floor muscles lifting and then relaxing. So the functions of the pelvic floor is the 5 S's: support, sphincteric, sexual, stability, and the subpump. So for support, it supports your internal organs such as bladder, uterus, rectum. And sphincteric control is where it has control of holding back stool and urine at an appropriate time and to control your urethra, vagina, and the rectum. For sexual function, it aids with orgasm and bringing blood flow to help facilitate that orgasm. For stability, it helps with stabilizing your pelvis, so including your pubic bone, which is in the front, your sacrum, which is in the back, and it's part of your entire pelvis. And then you have your tailbone as well, and then your entire hip complex. And then a subpump, so that serves as a venous and lymphatic pump for the pelvis. And so we're just going to go into the overview of the pelvic floor and core. So on the left-hand side here, you see there's a diagram of the most pertinent muscles that we would say we consider your core. A lot of people think that their core is their six-pack abs, right? The fancy abs that look really nice when you're toned and you're jacked, and they're really aesthetically pleasing. However, that's not the only piece of your core. A huge portion and a main, I'd say that one of the main, what's the word I'm looking for? Like main guys is the transverse abdominis. You can see here, it's pointed out on the diagram. It spans from the low back and it comes across the stomach, and it's like your own natural internal support, like your corset. So this serves to work with the diaphragm, which you see above, which is your breathing muscle, and then also works with your pelvic floor muscles, which are below, and you're almost like your second core. And then your multifidus is your low back muscles and span your entire spine to help stabilize your spine. So you can think and imagine all 4 of these muscles listed serve as like your 360 support. So this is part of your core. It's not just these 6-pack abs, which are called the rectus abdominis. To go into a little bit more detail about the pelvic floor muscles, I'm going to keep it short and sweet because we can get into the nitty-gritties, but just to keep it simple, there's 3 layers. So the layer 1 is the closest to the outside of the body. That serves as to maintain blood flow to the clitoris and sexual function. It also closes off the anus externally so that you have control to not lose any stool or any gas. For layer 2, that serves to close the vagina and the urethra. And layer 3 is collectively called the levator ani. On the top right picture, you'll see a downward looking view of all the muscles in pink and or red, you could say. And those on the bottom half are your levator ani. That functions for postural support, but also functions to help support, once again, like the rectal area and pelvic floor as a whole. So you can see that there's a lot of lots of layers, lots of muscle, and that they all have pertinent jobs, but they work as a unit ultimately. And so we're going to go into breathing. So this is a huge functional piece of pelvic floor. And this is something that I'm definitely going to stress a lot in this presentation. So I will repeat, key points to this as well. But we're going to go over on like, how does breathing overall impact the pelvic floor? So the diaphragm and the pelvic floor work as a team. They're a unit. They work together, and they will be most optimal when they work together. So on the right-hand side here, you see when you inhale, the diaphragm, which is at the top, that muscle drops down to create space for the lungs, and the pelvic floor drops down at the same time. So that the pelvic floor should lengthen and relax when you take an inhale. And then as you exhale, naturally, the pelvic floor lifts up as long as the diaphragm. So as you inhale, repeat that again. As you inhale, you take a breath in, diaphragm drops down, and so does pelvic floor. So it should relax. And this is with an optimally functioning system. And so we'll go into a little bit more detail about that later on, but I'm going to talk about the types of urinary incontinence. So
sorry to interrupt again. We're getting some feedback from some of our audience about changing the view on it. So I wanted to share.
Okay.
Someone said if you click on the upper right, then it'll give you slideshow from current slide. And then
slideshow from current slide. Okay.
Another person said on the bottom right of the screen to the left of the slide bar for size option, the bar set where it says 60% is the slideshow icon that would make the current slide full screen, if that helps. And then someone else said you have to make it full screen before you share it. So
I'm going to do that. I think that's the quickest. Okay. Let me do that.
I'm sorry to interrupt.
Okay. It's okay. It's okay. I would rather that, honestly. So I really appreciate everyone helping out. So 1 second, let me stop, and then I'm going to share again. No, it's not working. Let me share. Percentage of the bottom screen to make it bigger. Okay, let me see if I can do this. It's really hard to see. I'm going to do this, and then I'm going to do this. Okay. Let me know if this is better. Okay. Is this better?
A little bit, yeah. I mean, yeah, it's better than it was.
I can do even more. Is that better?
Yeah. Yes.
Okay. I don't know why. Because when I hit share, like when I hit the share at the top from the current slide, it won't. I have to exit back out to then get the Zoom back in, because it then presents the whole. It presents like the whole PowerPoint presentation, like takes up my whole screen.
Yeah. No, we can see it. We can see it.
Yeah.
Thanks.
Okay.
Yep.
Okay. Sorry, guys. All right. So these are the most common types of urinary incontinence. So you have stress incontinence, which is something we really commonly see in pelvic floor therapy. This is when you're having any type of leakage during any activity, movement related. Coughing, laughing, sneezing is the most common kind. However, jumping jacks, working out, anywhere from any type of, like, even running, even fast walking, go running up your stairs, any type of like movement related. And then urgency is when you have issues with bladder urgency in terms of like you have the strong urge and you cannot completely hold your urge back, and then you end up having, ends up going to leakages. Mixed incontinence is a combination of stress and urgency, and then you have the other two as well. So, just to give a brief overview of the types. And then going into the common causes, and it could be a plethora of reasons. However, these are just some common causes on the left-hand side here. You can see it could be weak pelvic floor muscles. It also could be tight pelvic floor muscles, where your pelvic floor muscles are under too much tension and they don't have the ability to lengthen to engage properly. Any types of hormonal changes, so menopause and postpartum, or even during pregnancy, you sometimes have leakage, towards the second and third trimester of pregnancy. Even first trimester, it doesn't have to be towards second and third. Any type of, bladder or kidney infection that can bring on urinary leakage, and then chronic conditions, and sometimes medications. You'll see what we commonly see with diuretics actually can have an effect on urinary incontinence. And I'm going to go into a little bit of detail about what is pelvic floor therapy, and then what should you expect when you come to like a pelvic floor therapy exam, because a lot of people come in and they have, they're not really sure about, what does it entail and what to expect, because it's not superly, it's not overly common in general. So I just want to provide a little bit of, a breakdown of, what we would go through, and to give it a little bit, give you a little bit more of an idea of how what an exam would look like, or just your first initial evaluation would look like. So first you would come and you would fill out the medical history forms and the questionnaires. And then we would sit and we would talk, you would talk with your patient and your PT, in a private room. And we would talk about your history, your medical history, and all your current symptoms or what's going on. And we would discuss, anywhere from your bladder bowel habits, sexual function, and then any other issues that are going on, low back, pelvis, hip related. And then we would go into the assessment. So the actual evaluation, we are, like I say, we're pelvic floor therapists, but we also are physical therapists in general. So we're going to assess your body as a whole. So we're going to look at your hips, we're going to look at your spine, we're going to look at the pelvis. We're going to check, how well do those joints move? How well do the muscles move? Test strength. And then we're also going to look in areas, for any tension or any, imbalances. So, going into the internal pelvic floor exam, if cleared by your, referring physician and clinically appropriate, we may perform an internal exam. And if warranted, based off your symptoms. Not every single person gets an internal exam. And it's also always, we like to stress, it's always with your consent and with your comfort level. It's decided between you and your therapist. And as the patient, you guys have the ultimate decision. And we like to always create a safe space for that. Because there is a little bit of, sometimes people come in a little bit of anxiousness surrounding that. And we don't always have to do it on the first session. And we don't always have to do it in general. We always provide a reason as to why we're going to do it. And if we feel that it's warranted and what the purpose is. So then in conjunction with that, we develop a plan that's individualized specifically to you that fits your needs. So what could pelvic floor treatment sessions look like? I tried to keep this vague, but it's really hard because it's a range of things, right? Like I said, we're treating the body as a whole. So depending upon what we find in your evaluation or assessment, we are then tailoring a program and your treatment sessions to what you need and what we need to address. So that can look like, for example, like retraining the pelvic floor and working on your breathing mechanics. So working on getting proper breathing so that the pelvic floor can then engage better. It could look at working on the core, in your proper core coordinate. That's a freaking tongue twister. Core coordination. So in terms of like being able to properly brace, which I'm actually going to go over in a little bit, and then giving you specific exercises geared towards your weaknesses that we found during the evaluation. So in conjunction to pelvic floor, we're also strengthening the hip muscles, the glutes, the adductors, the inner thigh muscles, so that also coincides with pelvic floor strengthening too as well, and/or relaxation. It can be either or. And then we could do internal treatments with your consent once again, to help normalize the tension in the pelvic floor if that's your issue that you're presenting with, so that we can then get a better recruitment from those muscles to prevent the leakage. We also would be able to focus on working on proper body mechanics with, any functional activity that causes the leakage. So sometimes I'll give you an example. Sometimes I'll have patients break down jumping jacks, and we'll go and we'll do a step-by-step, piece by piece, and then we'll build back up. If they're having leakage with squats, we'll do a breakdown, and then we'll build back up. And then last, another option is bladder retraining. If you have urge incontinence, sometimes we'll do the bladder retraining and the urge deferment techniques, so that we can work on, retraining your bladder, so your bladder does not have to be the boss of you. You are the boss of your bladder. So this is just a little insight on how to brace core properly, and then we're going to go over the Kegels too. So because this is through Zoom, I try to, as much as possible, keep a lot of detail on the slide. I am going to speak out loud about it too, and if you guys want to, practice behind the scenes, you most certainly can. But this is talking about the transverse abdominis muscle. So the muscle that I'm going to go really quick back up. You can see here is that 360 around your abdomen, that 360, support. So we're going to come back here. And so it begins with a proper breath. What is a proper breath? It is focusing on the expansion of your ribs. So that means all sides, the front, the side, and the back. And then a true diaphragmatic breath is both the rib cage and the belly expanding upon inhalation. So creating space for air. Belly breathing is a little bit more focused on expanding the lower abdomen during inhalation. So there's different types of breathing. To not get to the nitty gritty, that's something that is later down the line that could be, an option that you would break down with your physical therapist if that's, you choose to come to pelvic floor therapy. So just a brief breakdown. You're going to inhale through your nose. That's with your mouth closed. Expand your ribs like you're spreading your wings to fly, and expand your lower abdomen, releasing any tension that's there. And then as you exhale through an open mouth, you're going to think about zippering your lower abdomen from your pubic bone, which is right in the front, to your belly button by drawing up and in. So to repeat that, you inhale through your nose, keep your mouth closed, expand the ribs like you're spreading your wings, and belly expands, letting go any tension. As you exhale, you're going to zipper that lower abdomen from up and in. You shouldn't feel a lot of, I'm going to stand up real quick right here. You shouldn't feel a lot of tightening right underneath your lower ribs. If you feel a lot of tightening here and pressing down and out with the lower abdomen, that means we're doing the opposite motion. So this is something that I don't expect someone to get over just this presentation or to nail down this technique. It's just to introduce the idea. This is something that we do go over in pelvic therapy, very detailed and very specific to you. And if you need it, a lot of the times this is a foundational piece. So moving on into the Kegel. So like I said before, the breathing is very, very heavily incorporated with the pelvic floor. So a proper Kegel, this is very generic and very vague, but this is just to be helpful if some of you have already tried to do Kegels. This is helpful just to have, so you have it as, once again, some guidance. So it begins with a proper breath, meaning when you take the inhale in, the pelvic floor should be doing nothing but relaxing and lengthening. So you really shouldn't feel too much, but you should not be engaging your muscles when you inhale. When you exhale is when you try to squeeze the vaginal muscles by lifting up and in. Some visual cues or verbal cues that I will use for my patients in sessions that will help is some of the below. So one that works really, really well, actually, we always get a giggle out of people too when we say it, is pick up a blueberry with your vagina. So when you're inhaling, everything relaxes. And when you're exhaling, you're imagining you're picking that blueberry up and you're squeezing. Another cue, which is so common to people that often clicks with the brain quickest, is stop the flow of urine. However, I really, 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 really want to stress, do not practice Kegels while actually trying to stop the flow of your urine. This is not correct. This is an old myth way back when. The pelvic floor should be relaxing. It should not be contracting during peeing. It should be relaxed. So I do not encourage you to try it. It just is use that for your mind muscle connection when you're doing Kegel. Sometimes that's helpful for people. Another one that is a fan favorite of mine that I find the most successful, believe it or not, is suck up a thick smoothie through the vaginal canal. So we get pretty creative in pelvic therapy. We make it a little lighthearted because we have to get some giggles in there, but these really do work well. So I definitely encourage you to try, when you're trying the inhale, exhale, to try and use those cues to see if that helps you. And these are other considerations when performing Kegels. So like I said, I'm going to really stress the breath. Do not hold your breath when you're doing them. A lot of people will do and suck it in, try all their might to get the Kegel in, and it's not helpful. It's actually counterintuitive. So just always remember to open mouth, exhale, and lift up and in when you're doing that. Try not to grip other muscles in the surrounding area. We try to focus a lot on just isolating the vaginal muscles. So we try not to squeeze the inner thighs a lot or overly squeeze the glutes, your butt muscles, if you are trying to focus on just isolating the vaginal muscles. Remember that you don't always need Kegels if you have tight pelvic floor muscles. When we wouldn't know that unless we based off of symptoms, and then based off symptoms, we would then do an appropriate internal pelvic floor muscle exam with your consent. And then we would then determine if that's your issue. And then we would work on lengthening and relaxing, and then go into strengthening if that's necessary. So I do want to stress that Kegels are not always the answer, believe it or not. Oftentimes you're told do Kegels, do Kegels, do Kegels, do Kegels, but it's so much more than that. They're just a piece of the puzzle. So really, it's not a one size fits all or a cookie cutter approach. The best option for you is individual guidance by your pelvic floor therapist on how to perform a Kegel properly. And if it's necessary, like I said before, it's not always the answer, but that's definitely where you can start as your foundational piece. So just for my final tips and takeaways, for Kegels, make sure that you're doing the proper coordination. So make sure you're doing that inhalation, everything expands at rib cage belly, exhale, pelvic floor lip muscle squeeze, and lift up. With the proper breathing, the 360 breathing. So I always stress exhale with exertion. So when you find that when you're doing jumping jacks or when you're lifting your heavy toddler that has grown so much in the past couple of weeks, or you're lifting heavy weights and you're getting leakage because you might be getting leakage because you're holding your breath. So I always just encourage, try to exhale upon exertion. So the harder part of the movement, the lift, the carry, the hold, try to just let your breath go and try to, really relax those. Try not to overly tighten and hold your breath is what I'm trying to say. To prevent any leakage with like a cough, laugh, or sneeze, you can try to do a Kegel before if you can anticipate it. It's not always easy to anticipate because sometimes it just comes on and we don't know, when to expect it. So it depends. And then I say again, avoid the breath holding because that's not going to be your best friend by any means. It's going to put more pressure down on pelvic floor, and then it's going to cause more leakage as well. Another little tidbit that we would go into more detail in pelvic therapy, but it was worth a mention, is to avoid constantly sucking in your stomach and constantly tightening your abdomen. A lot of the times, I see as just our overall population, we typically hold our lower bellies in, right? We want to be smaller, we want to be skinnier. Society has put some pressure on us, and I find that it's so commonly that you're holding your tension in. So sometimes I encourage that actually is causing so much pressure down that's causing more leakage. So it's like, let your belly go, let your breath go, and try to just get that relaxation into at the same time. different from like intentional ab work and bracing too. And then bladder irritants. So this is something that we'd go into a little bit more detail if you had urge incontinence. So that's limiting anything that's like coffee, soda, seltzer, citrus, energy, alcohol. Like I said, that's just a brief, vague recommendation that I'm not saying to go and change your whole intake of what you drink, but just a consideration to take in consideration that that might also be contributing to that urgency and or leakage. But ultimately, we always encourage to seek professional help from your medical providers so you no longer have to live with urinary leakage for the rest of your life. It's never, never, never too late. And we would love, I had to put something funny in here. We would absolutely love if you could say, I come in and I sneezed without my legs crossed and I didn't leak any pee. After a course of, pelvic floor PT, we would be like, yes, we did it. We reached our goal. And like I said, it's never too late. It can be your 6 week postpartum. It can be during pregnancy. It can be 10 to 30 years down the line. We can still work on it. It's never too late. So I will leave it up to now. Any questions? I'll open the floor to questions.
Yeah, we're actually getting some great questions.
Oh, perfect. Hopefully I didn't go too fast. I tried to be slow. I'm a super fast talker.
There were certainly a lot of great questions, and I have to say, as someone who's a little bit older, the Kegels while peeing was not something I knew, and now I know that to not do that.
Yeah, it was common. It was a commonly like, oh, just try it when you pee, but it's definitely not productive, let's say.
Okay, so our first question is, if you're pregnant, do Kegels help with giving birth at all? And if pregnant, what exercises to do now to help prevent leakage?
Okay, so repeat the first half, please.
Okay, do Kegels help with giving birth at all?
So it depends. I'm going to say that a lot probably. But Kegels are not necessarily what push the baby out. Contractions are what push the baby out. And your pelvic floor muscles should be relaxed and be able to lengthen when you are going through labor and delivery if you're having a vaginal delivery. So it's not necessarily the Kegels that are doing the work. So you squeezing and relaxing your muscles is not what's pushing the baby out. The contractions, lengthening your pelvic floor, and being able to do that. We, as pelvic floor physical therapists, will do labor and delivery prep. So that means that we will, hopefully see you at any point in hopefully by third trimester. And that is usually at 32 to 34 weeks, we will start that. We will sometimes see you beforehand, but anyways, just to, keep it short and sweet, because we probably have a lot of questions. We will practice on breathing and, pushing mechanics on how to work on relaxing the pelvic floor and lengthening, and how to do proper, not necessarily engaging the muscles, but relaxing them, because that's what ultimately they need to do to get out of the way for the baby to come through. And then should you be doing Kegels during pregnancy? It truthfully depends. During your first and second trimester, if you're having leakage and you're having issues, we do encourage that you could, use those muscles more, like I talked about, the coordination and engaging them. But also it really depends on what, you're currently experiencing. So it's hard for me to say 100% yes. It's based upon what you need and an assessment, but you can do them to prevent leakage. However, we encourage towards your third trimester, you really should be focusing on pelvic floor relaxation and like pelvic mobility and hip mobility.
Okay. Is pelvic floor physical therapy recommended if you have a pessary? My urologist some time ago said it is not.
So we do have individuals that have come to us not for having a pessary, but for other reasons, and have had a pessary, and or we have referred to get a pessary. So it depends upon what you're presenting with. So I always come back with, what are your symptoms? If you're having urinary leakage, if you're having pelvic heaviness, if you're having feeling of, sensation in the vaginal canal, feeling that something's in the vaginal canal, those types of things, and or difficulty with emptying your bowels. We didn't really talk about bowels at all, but that's a pelvic floor function. So it's really dependent upon what you're currently experiencing. Like if there's any issues functionally, sometimes pessaries are all you need for what you're currently dealing with. But I wouldn't say that it's not helpful.
Okay, why can COVID cause urinary incontinence?
So I don't have like a direct correlation, but it might. I'm not sure because has been a whole lot of research that I have specifically dove into myself. But in terms of, is it, well, when you had COVID? Is it after the facts? So there's, multifactorial pieces there. So I can't really draw a conclusion based off of, COVID causes urinary incontinence. It could be that, a lot of coughing and sneezing, or, coughing with a, chronic cough for X amount of time has caused more pressure on the pelvic organs, causing some changes anatomically, causing some more leakage. So as you can see, it can be a cascade effect. So it's really hard for me to say that, X equals this. So yeah, I'm sorry. I can't really answer that 100%, but that was to my best of my ability.
Do pelvic floor therapists treat frequent urination?
Yes, they do. So that's where we would go through bladder retraining. So first we would have you most likely do a bladder diary, and we would see what your theme is in terms of how much you go, what you drink throughout the day, what you eat throughout the day, just to get a brief overview of your habits as a baseline. And then we would, assess, from there, assess and try to come up with a way to, individualize for you of what works, and then, trial and error from there to see how we can fit it into your own daily routine to help mitigate that frequent urination. But I will give a little snippet. So you should go about every 2 to 4 hours is appropriate. If you're drinking a little bit more fluids, you might go a little bit more sooner, but every 2 to 4 hours is an appropriate amount to go.
What is the average number of pelvic floor therapy sessions?
This is the famous it depends. However, and it depends upon what you're presenting with, and ultimately it's between you and your therapist and what you come up with a plan. So your therapist is you're going to tell your therapist your goals, and to make it realistic, we'll give you a brief time frame. So with pelvic therapy here, we do 1 time per week. And we always give you something at home to take home for your homework, because that's where you're going to get the most optimal results. So I would say we would at least see it for a minimum of 10 sessions at least, sometimes sooner and shorter, and sometimes, way longer. It depends also upon the chronicity of what you've been dealing with. I always say when I get someone that comes to me that has been dealing with urinary leakage for 10 years, we are not going to cure it in, a couple weeks, may not even be a few months. It might be up to, 6 months to a year. And I have that honest conversation with them. And, the more diligent you are with your home program is really, and with showing up to appointments too as well. We understand that it's tough because our population is busy, kids to take care of, and life's busy and the chaos. So I would say ultimately about anywhere from a minimum of 3 to 6 months. Could be shorter, could be longer.
Okay, what is the solution for leakage while running or high impact movements?
So this is one of the most complex to treat. It would be ultimately pelvic floor therapy, because this is one of my favorite things to treat. Actually, I'm an athlete myself. I've been my whole life. And this is, I would say, my niche. So we would look at the body as a whole. So when I always say, and I'll give this as like an example that might like blow your mind, but I have had a patient had her urinary incontinence completely cured by working on all her hip. So like I said, we zoom out to address the body as a whole. So we're going to look at the body as a whole system. How does it operate as a whole? Because running, it's not just running. It's, what's the impact from the floor? What is the ankle doing? What is the knee joint doing? What is the hip joint doing? How well are you at, what's your posture? What's your muscle strength and those muscles that are important for running? So we're really going to do a deep dive there to break it all down, to build it all up, to then also give you guidance in terms of like, okay, when do you leak? Do you leak when it is mile 3 or mile 16? Do you leak when it is, you go at a quicker pace or a slower pace? So it truly depends. I know I keep saying that, but it's hard to answer when it's a little bit more of the nitty gritty specifics and not like there's not one size fits all approach. But hopefully that was helpful in, giving you some of an idea of like what pelvic therapy would address with specifically, urinary leakage with running.
What about anal leakage?
Anal leakage. So that is not the focus of today's presentation, but that's something that we do work on as pelvic floor therapy. That can look anywhere from like specific rectal balloon training, which is training the anal sphincter to be able to, build up the endurance and strength of that. It truly depends upon that's just, one option of treatment, but it depends upon why your leakage is occurring, and our assessment. Based off our assessment, we would then tailor a treatment plan towards you.
Okay, I'm going to combine a couple of the next questions because they're similar.
Sure.
So what's the best way to be seen during pregnancy for the for labor prep, and is a physician referral required? And someone else is asking, must one see a pelvic floor doctor prior to seeing a pelvic floor therapist? So I think they're both kind of about referrals and how to get to the service.
Okay, perfect. Yeah. So we would need a referral from your OB, your GYN, your primary physician, your midwife. It's truly anyone, like any physician, that you would just need a script for if you would want to do labor and delivery prep. That answers, right?
Yeah. Yes, I think so. Just even with the labor prep. So that's like an insurance covered service. Is that?
Yeah,
Or
so that is something like it would depend upon what you are, presenting with. If you're coming in with, you know, say you have like low back or something of that sort. There's, core weakness or, et cetera. Yes, that's covered by insurance. It also depends upon what you are coming in for in addition to that, right? So it's like, you can, it's care for pregnancy. So it's covered. Sometimes in conjunction, we're treating other things though. So hopefully that answers the question. But yeah, you would need a referral from your physician. Any physician is possible. But I do want to just put a disclaimer out there. We are very blessed to be very high in demand. However, do expect with getting a pelvic floor evaluation, when you go to book it, do expect that it's going to be a minimum of most likely a 3 to 4 month wait list. We are a team of 5 people, and we try our best, but there's just a very high demand, like I said. So there's, just to expect to plan. If you want to plan, if you're pregnant and you want to plan for that prep, I would plan accordingly and book it way far in advance. So that, yeah, you can get in at an appropriate time. We try our best, like I said, and we have cancellations. We can get you in, but ideally, yeah, do expect that there's going to be a 3 to 4 month wait list for evaluations.
Okay. Should everyone be doing Kegels in general at a certain age or at all ages?
No, it's just dependent upon what are you having issues? If your pelvic floor is functioning and you don't have any urinary leakage, any gas incontinence, any, fecal incontinence, and just going into a little bit more details, not based upon the urinary leakage, but no pain with sexual intercourse. Those are just some topics that, we ask you when you're in you're in your evaluation, then no, Kegels don't necessarily need to be done. Your pelvic floor is always working. Otherwise, your organs would fall out of you, right? It's serving as your core. Your muscles are always working as your support system. So not necessarily do you always need to be doing Kegels. Sometimes, like I said, Kegels are so stressed. They get so stressed in the, you know, I guess you can say female population world, but it's not always a end all be all answer. It's a lot greater than that.
Okay. Can you explain in greater detail what can be done to be sure to fully empty your bladder?
Yes, most certainly. First and foremost, you need to be relaxed completely, right? So I would always encourage, like, if you're don't rush pee, don't strain, don't push to strain. A lot of us sometimes like we'll go and we'll be like, I have to pee, I have to pee, I gotta go, and then I gotta run out of here real quick. My moms often do too because their kids are banging on the doors or they're running into the room, into the bathroom, like ma, right? So I always encourage, like, just take a second, take a breath, um, pee, don't push. If you have trouble with fully emptying, another option could be that you could do a slight forward lean and then see if you lean back. That will just change positioning of bladder a little bit to help. So slight forward lean and then lean back and try to pee more. Another option is what we call double voiding. You would pee and then you would, this is hard, stand up and then sit back down and try to pee more. Like I said, it just changes the bladder positioning a little bit so that you can fully empty. And that's if you are having issues with emptying. So I don't always encourage that if you're not having issues at all.
Great. Okay. Are all the therapists female?
Yes, all the therapists are female.
Okay. Let's see. Can pelvic floor therapy help groin hernia while pregnant?
So yes, it can. It's not necessarily going to fix the hernia. However, we can teach you how to manage your pressure in your abdomen better so that you're preventing worsening of the hernia. And then we can also teach you how to retrain the core in that 360-degree fashion, that deep, deep core. That's going to be your ultimate support when you are, especially when you're pregnant. So to help prevent any worsening of it.
If urgency resulted from a natural birth, could it go away on its own over time?
I can't necessarily say yes or guarantee it. It depends upon when the urgency began after postpartum. And if there's other factors to consider in terms of, any anatomical changes to the organs after postpartum, the pelvic organs, any changes in terms of like dietary and fluid intake. So those are things to consider as well that could potentially influence that.
Okay. Do you recommend yoga or Pilates or some other exercise regimen to support pelvic floor?
Oh, it's probably correcting to public.
Oh,
um,
pelvic floor. No, I just said
oh.
yeah,
I'm like,
pelvic floor.
no, it's fine, it's
Okay.
fine. I'm like,
Okay,
it's
sorry
probably
about
like
that.
auto correcting.
No, that would just be me.
Hey, we're human.
Yeah.
So yes, Pilates is super helpful in training the deep core muscles. I do also encourage any amount of strength as well, because strength training in conjunction to Pilates and yoga is going to be your ultimate, holy grail combo. So strength training is going to keep your muscles strong, and then and that can look different for everybody in terms of like how you want to do it. But we also encourage strengthening the hips, the core, and the pelvis. But yoga for sure will be helpful for pelvic floor relaxation and for coordination of your breath and pelvic floor and core bracing. And then Pilates will be really good for all your little small stabilizers of your core and your hips. But I would say ultimately combining that all with strength training would be really awesome. But any type of movement, any type of exercise, I would promote 100%. Anything you can get in, get will be super helpful.
Okay, this is my favorite question because it can be answered so beautifully. If What activity do you think we should not perform, i.e., raking leaves, lifting packages after shopping? Can I'm thinking that's a great way to get out of raking leaves. If you answer,
Yeah.
yep, no, no leaf raking.
For this purpose, I'll say you don't have to. No.
So,
So what activity to avoid overall? So we often don't want to, tell you to avoid any activity if it's causing issues for you. We would try to, if you were in pelvic therapy, we would try to find ways that we can work on body mechanics. We can work on optimizing how to perform that activity to your best ability so that it can mitigate any issues that you're having during that. So, if that's your goal, and if you just don't want to do it, you don't want to rake leaves, don't do it. I would say you don't have to. But if there's something that, you have had leakage during and you still want to continue to do, that's where we would then work on it together in our sessions. And, if you came to me and you said, Corinne, I really have leakage during burpees or squats, then I would be like, okay, let's break it down. Let's see why that's happening. Boxing, I've had, I have a pelvic patient right now that has leakage during boxing, and we are breaking down and certain movements, and then we are also giving her very specific exercises to in to what's the word I'm looking for? It's 8 o'clock at night, and I've lost it, but it's basically to enhance like her performance during boxing so that she can not have as much leakage, just to give you an example.
okay. Does pelvic floor therapy help loosen tight hips? Scared to give birth with such tight hips. I had a labral tear surgery 13 years ago.
So it's not the primary purpose. Once again, we would look at the hips as a component. We would look at how that's influencing, your ability to have that mobility in the hips, and how does that influence the pelvic floor? So yeah, it's something that we could definitely address for sure.
Okay. Is pelvic floor physical therapy covered by Medicare?
Yes,
Great.
here at
Okay.
Valley it is.
Okay. Um, so someone had asked that I answered, I typed the answer in about how to find a pelvic floor physical therapist. And this is a follow-up question. Here's someone in her third trimester with her second pregnancy and has horrible incontinence. And since our Valley's availability, are there any neighboring programs that also have pelvic therapy? She was under the impression that the service was self-pay. So I guess if someone's looking in general for a pelvic floor physical therapist, is there,
One that's covered.
yeah.
Okay. So another hospital system is there is Holy Name in Oradell has pelvic floor physical therapy, and then there also is Atlantic Health System. They have about 8 locations actually of pelvic therapy. So that could be an option for you too. I know there is a lot of private physical therapists too, which are self-pay and or out of network, but um, yeah, I would say those are the 3 main that I know of in terms of like accept insurance for a hospital-based system.
Okay. This individual has a tilted uterus and she writes, what can I do to fix it? But I'm guessing that's related. Does the pelvic floor PT fix that? Or is there anything to?
Pelvic floor T does not fix that. That is an anatomical that is unique anatomy. That is not something that we can anatomically fix.
Okay. Um, Now this I think relates to your introduction to what specialists typically treat and prescribes pelvic floor PT. Oh, what specialist treats and prescribes? So,
Okay.
okay,
So when you're looking for pelvic floor therapy, you want to look for a pelvic floor physical, pelvic therapy. Sorry, a physical therapist that specializes in pelvic floor. It's often saying the pelvic floor physical therapy. Sometimes you have a pelvic floor therapist that or says that they can do pelvic floor, but there is no internal assessment or internal treatments. Not saying that that's the only reason or that's the only thing you need to do. However, with the most comprehensive view, you I would recommend that you go to a pelvic floor therapist that is able to do that to make sure that there's not anything more going on. If it's just purely external, sometimes that there is things that are often missed that are a big piece of the puzzle. So I would say that a pelvic floor physical therapist or a physical therapist that specializes in pelvic floor and any OB, midwife, or any et cetera, they are who refer. Like I said, or primary care physician. It doesn't have to only just be an OB.
So you don't have to see a urologist either.
You could see, no, you don't have to. You can have your urologist, write your prescription, but you don't have to see one before you come here. But I would encourage that, you know, there's a reason why, right? So there's typically it's like, okay, we would encourage at least getting some type of um exam or whatever. Just you don't have to, but sometimes it's like, okay, depending upon what you're coming for. If you know, and I've had patients that know, and they're like, well, I'm having X, Y, and Z, and so that's why they will have their PCP write it if that's an issue. Sorry, is that clear?
I think